Good morning, friends. Myself, Dr. Seema Garg, Diplomate of American Board of Hair Restoration Surgery and member International Society of Hair Restoration Surgeons. Today I am going to talk about the paper which I presented in the World Congress of ISHRS this year at the Bangkok. Artistic use of beard and chest hair to enhance the aesthetic result of hair transplant. Hair transplant is becoming the most common cosmetic procedure across the world. But it does not mean putting few hair on the top of head. Rather, it should be done with so much perfection that it encourages the person to improve on other aesthetic aspects also. A good hair transplant can change the person in toto. Here you can see. But the biggest limitation of hair transplant procedure is a big discrepancy between demand and supply. And the body hair follicles are good source of donor hair follicles and can be used along with the scalp. But the characteristic of body hair are different from that of scalp. So to get the aesthetic look, we have to use them artistically along with the scalp hair. Most commonly we use beard and chest hair. So the beard and chest hair can be used in two ways, either as an adjuvant or as a combination. As an adjuvant to previously done hair transplant to reduce scalp show, and as combination during the primary procedure, that is first hair transplant along with the scalp hair follicle. Now as an adjuvant we use in patients who had previous hair transplant but wants more coverage and density, and scalp donor is not sufficient to cover the deficit. For anterior hairline revision and for temporal triangle reconstruction, we use mainly scalp hair follicle, and if scalp not available, then we can use chest hair follicles. For forelock, mid-scalp and crown, beard and chest hair in between the existing scalp hair can be used. Never use only beard hair follicle in the crown. Here is the case in which previous 2 FUT and 1 FUE was done. So scalp donor is almost exhausted. We have body hair and now the demand was much more, the scalp show was very much there. So we use chest hair follicles for the reconstruction of the anterior hairline and anterior hairline zone, and then in the mid scalp we use beard hair follicle in between the already existing scalp hair follicle, and in the crown area we use remaining of the beard, chest and abdomen. And here you can see the results. There is drastic improvement in the density and look. Another case in which also previous 1 FUT was done for the frontal area, but patient was in grade 7 and mid-scalp, crown, vertex all was empty, so patient wants more. Again we do 2 days session, one by the FUE from the scalp, FUE, and we take 2567 grafts by the FUE, and then on the next day by beard and chest. And here you can see the result. Whole of this scalp it is covered and patient is very happy. Now during the primary procedure, that is the first hair transplant, we use along with the scalp hair follicle, and this we call as combination grafting. Now why beard and chest hair are used in first hair transplant? Young patients with positive genetic history, so there are all chances to go in grade 7, and we want to preserve the scalp hair follicle for the future. Beard and chest hair follicle growth is androgen dependent, and this is the advantage in patients who don't want to take finasteride. Beard hairs are thick and curly, so along with the scalp hair, they increase the visual density and give a bounce to the implanted hair. Thickness of the chest hair is not good as compared to the beard and scalp, but still it is the better alternative of the scalp micropigmentation. For combination grafting, scalp hair follicles are mixed with beard hair. All cases of Norwood grade 4 and above are examined and evaluated for donor availability of scalp and body hair. Detailed discussion is done with the patient and consent is taken for the combination approach of implantation. Scalp hair can be harvested either by FUT or by FUE depending upon the patient's choice. Beard and chest hair follicles are harvested by FUE, initially only from the shadow area. Now, in Norwood grade 4, we usually plan for 2500 to 3000 grafts, and out of these, around 20 to 30% we take from beard, that is 600 to 900 follicles. 2 cm of the defined hairline zone, this is the 2 cm of the defined hairline zone including the transition zone. We implant only scalp hair follicle, and it is implanted as per the standard guidelines described by Shapiro and others. Then in the 3 rows just behind the frontal 2 cm area, we mix scalp and beard hair in the ratio of 2:1. In forelock area, we mix scalp to beard 1:1, and in the mid scalp area, we implant the remaining beard hair mixed with the scalp hair follicle. So this is the final plan. And here you can see the results. In Norwood grade 5, we plan for 4000 to 5000 grafts, and this we usually do in 2 days session. In single harvesting either by FUT or FUE, we harvest around 3000 grafts from the scalp donor area and remaining from the chest and or beard. Planning of implantation of mixing of the scalp to body ratio remains the same as explained in grade 4, only that the remaining body hair are implanted in the mid scalp area. And these are the results you can see. Now in grade 6, we plan for 6 to 7000 graft. Now out of this total, we harvest around 4 to 5000 grafts from the scalp in multiple stages, and remaining from the beard and other body parts. In between 2 stages, a minimum of 4-month gap is given. On any given day, we do not harvest from more than 2 body area, and all precautions are taken so that the dose of the anesthetic agent remains within the safe limit. This is the planning. You can see this is the grade 6, and here planning is done, and this is anterior hairline zone, and in this zone we implant only scalp hair follicle. If not available, then chest hair follicles can be used. After that, this is the zone for the body hair along with this scalp hair. This is after day 1. So these are all scalp hair follicle. Here spaces are left in between the 2 implant, beard and chest hair follicle, and this is the final show. Here are the result, and this is the early result just after 6 months. So definitely it is going to improve. Again, now in grade 7, we plan for 7 to 8000 graft in multiple sessions, and planning remains the same as in Norwood grade 6. These are some results. So beard and chest hair follicles are good source of extra scalp donor hair follicle to cover up the deficit of demand and supply of donor hair follicles. If these follicles are used artistically, they will certainly increase the aesthetic look of the transplanted scalp. For further reading, you can refer to the article published in Hair Transplant Forum International, The Use of Body Hair for Combination Grafting to Enhance the Visual Density of Hair Transplantation and Increase Coverage of Advanced Alopecia. Thank you.